Good day to all. Ms. Creque here. Thanks to those of you who are joining me live. If you're watching the recording and have questions, please post them on the thread below the video and I will respond. I'm so excited and proud of each one of you. You are quickly approaching the end of the program and NCLEX is on the horizon. Our topic today is preparing for NCLEX. Well, what exactly is NCLEX? Well, NCLEX is a nationwide exam. It stands for National Council Licensure Exam, and they have been given across the United States and Canada since 1982. The purpose of the test is to ensure safe, competent entry-level practitioners that's measured by the CAT. Well, not that CAT, but the computer adaptive tests. These tests used to be paper and pen, but they changed them some time ago to all computerized. Basically, what that means is your test questions adapt or change based upon your responses. Now, what that does is it measures the ability of the tester in relation to the passing standard. Now, we're going to address passing standard here in just a few moments. That's 95% confidence interval. But first, I want to share with you a little bit more about the test questions. Well, first of all, there are between 75 and 265 test questions on the NCLEX RN. Those test questions can be a variety: multiple choice, select all that apply, fill in the blank, dosage calculations, those medications, hotspot or ordered responses, basically putting things in order. And then audio or graphics. You may have to listen to lung sounds, for example, and identify the particular lung sound in order to determine what intervention needs to occur. So, all kinds of questions. However, you have 6 hours to answer up to 265 questions. So you want to be able to kind of take your time, but not too much time. Back to that passing, for example, I want you to watch this short video clip by RN Kid, and he explains how the passing standard is measured, and I think you'll find it really interesting.
Here is an example of someone taking an NCLEX exam. Each point on the graph represents where the writer stands after the previous question. The blue line represents the passing grade. Every time this individual answered a question correctly, the points on the graph moved higher. Every time this individual answered a question incorrectly, the points on the graph moved lower. The minimum number of questions every writer takes is 75. At this point, you are evaluated to see if you are above the passing line or below the passing line. In addition, the computer also needs to be 95% confident that you will either stay above or below this line for the remainder of the test. After 75 questions, each and every question is evaluated the same way. Once you reach a question and the computer is 95% positive that you have either passed or failed, the test will simply turn off.
Now, if that test does turn off, you are done. You haven't done anything wrong. You haven't hit any buttons. It's okay. We know that you'll get results a couple of different ways. If you waited, it'll be a couple of weeks, but there's always a trick to try and figure it out. But if you want more information on that, you can go right to that website that's listed on the screen. So the question is, how do you master the NCLEX exam? Well, basically, you have to understand the test plan and you have to choose the correct responses. The NCLEX test plan is the blueprint that details test content. It provides an in-depth overview of each content area delivered in scenario styles. Now, you can learn more about test plans by the link on the screen. So here is, actually, this is from kevinsreview.com. It's also in the test plan itself on the NCSBN website. But this gives us the distribution of content for the actual test plan. And I'm going to be reviewing this pie chart here in just a few moments. But first, I want to share that the focus of the NCLEX is not medicine. By that, I mean it is not the medical model. It really is the nursing model. We want to be mindful that we should be answering questions based upon what we as nurses would do. So we want to use the 4 phases of the nursing process. Assessment. First, we need to assess the patient needs and select the nursing diagnosis accordingly. Then we want to develop the plan of action based upon the patient's status, and then apply nursing and medical interventions safely that address the plan, and then review the plan in order to determine if the actions that we took were appropriate. Now, let's get back to that test plan. There are 4 different areas, and they're broken down in categories. And you'll notice that there are numbers in parentheses along the way. And though that is the percentage of those types of questions, if you will, that are represented on the test. So under the management of care, 17 to 23% of the test is in that area. And what that means is that the nurses will be providing, directing, and coordinating care that protect patients and staff. So patient advocacy issues, advanced directives, obviously that's a protective factor, and then collaborating with the interdisciplinary care team. Safety and infection control, 9 to 15% of the test, protects patients and staff from health and environmental hazards. So for example, if you have a patient that is on contact isolation, we want to make sure as clinicians that everyone going in and out of that room dons and doffs, puts on and takes off the personal protective equipment appropriately so that there's not any transmission of any infective agents. Also, if that patient is going home, we want to ensure that when he's discharged, that he is going home to a safe environment. So here's a quick question. The nurse is assigning the unlicensed assistive personnel to assist the following patient to ambulate. It would be most important for the nurse to review safety precautions with the UAP prior to ambulating which one of these clients: a 44-year-old with Meniere's disease, a 59-year-old with a unilateral cataract, a 62-year-old with presbycusis, or a 65-year-old client with sinusitis. Well, I'm sure you know the response is that 44-year-old client with Meniere's disease, because Meniere's disease has recurrent episodes of vertigo, which is a spinning sensation that stops or starts spontaneously kind of whenever it wants. The patient can also suffer from hearing loss that may come and go. So that is a safety issue. So that UAP needs to be aware of what may occur with the patient in order to protect them and make sure that they are ambulating safely. Health promotion and maintenance, 6 to 12% of the test is on that. Provision of care based upon the expected levels of growth and development, and preventing or detecting early health issues. So for example, you have a pregnant mom. We want her to get appropriate prenatal care. So we want to tell her about prenatal care, but we also want to educate her on what she should do while her baby is developing. Conversely, after she has delivered the child, we want to do the same. Or if we have patients that are engaging in high-risk behaviors, we want to help to manage those behaviors so that they do not lead to maybe worsening of their disease. So for example, a patient that's a hypertensive, we want to encourage them to decrease the salt and fat in their diet so that their hypertension does not get worse. Psychosocial integrity, 6 to 12%, provides direct care that supports and promotes emotional, mental, and social well-being of our clients. So take a look at this question. I think it really does depict that. The nurse is talking with a client who had a colostomy created 2 days ago. Which of the following statements by the client would indicate ineffective coping? Select all that apply. So of these 5 choices, which 2 would be the ones that would be indicative of ineffective coping? Well, certainly, number 1, I am not touching that disgusting bag. And then number 5, I do not understand why I cannot have a nurse perform the colostomy bag changes for me. Because patients with stomas face different levels of loss at physical, functional, psychological, emotional, and social levels, we have to be mindful of the responses that the patients provide. So that will indicate how they're coping with their new body image reality. And clearly the patient in this example was not coping effectively. Physiological integrity, basic care and comfort, 6 to 12%. That's where we're going to provide care and comfort in regards to performing activities of daily living. So we want to make sure the patient is able to eat appropriately, that we're promoting sleep and rest. And if they need assistive devices like maybe a built-up spoon in order to be able to help them to do that, that we are assessing that appropriately. Pharmacological and parenteral therapies, 12 to 18%. This basically, we're administering and managing medications and or parenteral therapies, evaluating the responses to medications, educating about medications, and assessing for adverse effects, precautions, or contraindications. Reduction of risk potential, 9 to 15%. Nurses reduce the likelihood that client will develop complications or health problems. So we want to make sure that we're performing focused assessments, that we're educating clients about treatments and procedures, and that we are assessing and responding to changes that may occur in their vital signs. Physiological adaptation, 11 to 17%. We as nurses manage care for patients with acute, chronic, or life-threatening illnesses. Uh, we want to assist with invasive procedures, performing suctioning, performing wound care dressing changes, and then, of course, teaching patients how to do those things for themselves once they're discharged back home. Testers need to be knowledgeable about the content enough to understand the scenario that's provided to be able to appropriately apply nursing actions to the situations. That's how they're going to answer the questions. However, if they're not familiar with the content in the question, they need to use their nursing knowledge, their clinical experience, and test-taking skills to make the appropriate selections. Some success tips: don't rush, take your time. You have up to 6 hours. Look for keywords like accept or not. They're going to give you a key. Practice makes better. If you're comfortable with practice, then you'll be comfortable with the real test. Don't change answers without a very good reason. If you think it's B, if that was your initial thought, then you're probably correct. Each question is independent. So answer it only in that particular vein. Don't worry about what happened before, what's coming up. Well, what about if? Nope, everyone is independent. Age groups may change with each question, and diagnoses will change with each question. Don't pick the options with qualifiers like may or usually. That's for general terms. And absolutes typically mean the statement is false. Nothing is always anything, or all, every situation is different. So when you have those absolutes, those are probably a false statement. So in preparing for NCLEX, you want to practice, practice, practice. As you practice, focus on the areas that you do not perform well in. If you don't perform well in insulin administration, then that's what you need to practice on. Purchase UWorld. That is a wonderful NCLEX prep tool, as well as your ATI resources. Again, you can access the test plan here with the link on the screen, as well as the NCLEX candidate bulletin, in order to get additional information or to get down to the fine details in regard to the test plan that I mentioned earlier. Remember, the NCLEX world is utopia. Utopia means we have enough supplies, we have enough staff, it's all roses and sunshine, and there are no issues. Take your time, read the questions up to 3 times, and good luck. You're going to do it. Have a good one. Your references. Thank you.